you guys for coming today. This is the Share Your Story with Policymakers webinar. This is a really great opportunity to familiarize yourself with how to best tell your rare disease story, especially with Rare Across America coming up. So thank you guys all for being here, and thank you to our coaches for joining us today. I appreciate everybody taking the time to join us. So Britta, you can go to the next slide. Okay, so during this webinar, you are going to learn what to expect once you get into your meetings with your members for Rare Across America, and how to adequately prepare yourself for those meetings. We are going to give you some tips on how to give your elevator pitch effectively. So we're going to refine that a little bit, and we're going to go over some tips on how to develop a clear ask. You're also going to receive tips and coaching from fellow advocates and EveryLife staff. We'll go over a bit about what that looks like in a few slides from now. And you're going to practice and receive feedback from our team with personalized coaching during smaller breakout sessions. So we're going to walk through some tips here, and then we will go into breakout rooms. Caroline, I'll turn it over to you.
Thanks. Hi, my name is Caroline. I'm from Virginia, but I live in DC and go to school in DC. And I have been attending Rare Disease Weeks and Rare Across Americas since 2019. So hopefully I can share some of my experiences and help you guys feel more prepared for your meetings. So make sure that you get to know your legislators. Make sure that you have the correct position, that they're in the Senate or the House. That has happened. Make sure that you are aware of all of the meetings that you have and the time. That's just the first one. And then it's important. Could you go back to the previous slide? Yeah, thank you. So understanding what committees they may be on, understanding who they are in relation to your asks. So for example, a common ask is the Rare Disease Legislative Caucus. So if your members are already on there, maybe thank them. And if they're not on there, you can prepare information to pitch for it or advocate for it. Just making sure that you know where your legislators stand on current rare disease issues so that you can make your asks more targeted to them and feel more personal and be more effective. Okay, so preparing materials specifically. So key messages, that's bullet points, who you are, your condition if you feel like sharing, and the legislation that you are coming to bring forward to advocate for. So we have elevator speeches, also called elevator pitches. And they're called this because they last around the same time as the length of an elevator ride, so 90 seconds. It's a good way to cut to the heart of a legislative ask and get to the heart of a specific policy without taking up too much time from other advocates or taking up too much time of the people that you're meeting with. So for supporting materials, I love to bring one-pagers, which is a one-page piece of paper about either my condition or about the legislation or both. I generally bring both. And I also like to bring business cards that have my contact information and the information of my organization. And of course, when I'm preparing, I like to understand both my specific needs, like how I would benefit from these legislative asks, but also how my community, both my disease specifically and how the greater rare disease community can benefit, just to make these asks more universal in both connecting to a specific constituent, but the millions of us out there. So what legislators expect from you? So to be informative, compelling, and concise. I think those are all very important. It's important for legislators to see you as a constituent and an individual. Oftentimes, we kind of get lost in the numbers. When you hear that 1 in 10 people have a rare disease, that can kind of feel very abstract. But when it's, I'm a specific 20-year-old constituent in your district with these issues, it personalizes and humanizes it to people who have potentially never been exposed to these issues. So it's very important that you approach them on a personal level while still being appropriate and professional. As I mentioned earlier, one-pagers are very important. Be prepared with the information to hand to them, because sometimes overloading people with verbal information can be too much. So that's why I'm a big fan of giving people paper or follow-up emails. Make sure you ask for your contact information of your legislator, so that you can send follow-up communications. And also, it's super important to be authentic. It's good to have a general outline of what you're going to say, but it feels more powerful when you're not reading from a script, if that makes sense. Be true to who you are and to your story, and don't be afraid to maybe slip up a little, and as opposed to sounding robotic. So, message delivery. So it's important. So when it comes to message delivery, it's important to know that you're in control. It's your story, and you can control what you say about it and what you tell. So if you're more of an open person like me, you can share more information on the personal side as opposed to the legislative side, or you can share as little as you feel comfortable with. You're in control. Balancing fact and emotion is very important. It's important to bring emotion to this discussion because it brings power behind a statistic. So saying 1 in 2,000 people has narcolepsy is an important and true fact. I have narcolepsy, but it's more important to say I barely survived high school because of my condition, and that's why this specific piece of legislation is important, because it will help real students struggling today. So it's important to add both, to add context and humanity. And less is more. I understand, as someone who talks a lot, that if you get the spotlight, you might want to tell your entire life story. And even though your life story is important and fascinating, or the entire complicated scientific background of your condition, that can be overwhelming and also draws time away from other advocates who have equally important information. So it's important to be aware that sometimes less is more, and you can always add more information in follow-up emails or future legislative events. So those are just important things that I like to keep in mind. And then for specifically crafting your message, it's simple to break it down into 3 stages. So the problem, what is the issue? So for example, newborn screenings. A ask that we do very regularly is the reauthorization of the Newborn Screening Saves Lives Act. So what's the problem? There are congenital and birth and other forms of conditions that can be screened for at birth, and if they're not caught, problems can happen. So what's the solution? There's screenings, and that is a very easy and very elegant solution, and it's also very effective. So the ask is that your legislator supports the reauthorization of the Newborn Screening Saves Lives Act. And going back to preparation for your meeting, if they've supported it in the past, mention that and commend them. And if it has already passed the House, just for example, if it has already passed the House, make sure you know that. So if you're asking a House rep for something that's already gone, just make sure that you're aware. But I think it's very easy to break it down into problem, solution, and ask.
All right, I think this is my turn. I'm going to talk about developing your ask and kind of what our asks are, the legislative asks are. So you can go to the next slide. So for Rare Cross America 2022, excuse me, these are the 4 recommended legislative asks. And so the first one will be asking your member of Congress to join the Rare Disease Congressional Caucus. And then the next one will be asking for their support of the Newborn Screening Saves. Oh, okay. No, we can go. We can go to the next one, Caitlin. And so the first one is asking your member of Congress to join the Rare Disease Congressional Caucus. And so what the problem is that there are over 7,000 rare disorders that together affect more than 30 million Americans and their family, which is about 10% of the population. Rare orphan diseases are defined as diseases affecting fewer than 200,000 people in the United States. And many of these diseases are considered ultra rare, which means they affect fewer than 100 people. And many of these diseases are life-threatening and have no treatment options. And so a great way to help many of these problems is for your member of Congress to join the Rare Disease Congressional Caucus, which helps to bring public and congressional awareness to the unique needs of the rare disease community, including through patients, physicians, scientists, and industry. It also seeks to create opportunities to address barriers to the development of and access to life-altering treatments. And so the ask can be asking your member of Congress to join the Rare Disease Congressional Caucus. It is important to note that before your meeting, you might want to check and see if they're already a member of the Rare Disease Congressional Caucus, which you can do via their legislative, the RDLA legislative scorecards. And if they are already a member of the Rare Disease Congressional Caucus, make sure you thank them, but then there's no need to ask them to join it. And Caitlin, you go to the next slide. So the second legislative ask is asking for their support of the Newborn Screening Saves Lives Reauthorization Act. And the problem is that about 1 in 300 babies born in the US are detected to have potentially devastating conditions through newborn screening. And these newborn screening programs vary widely by state, leading to disparate health outcomes, which means some states may screen for 30 diseases, while other states may screen for more than 60. And the federal newborn screening program has been expired since September 30th, 2019. So this bill seeks to reauthorize the Health Resources and Services Administration, or HRSA, state grants to expand and improve screening programs, provide educational resources to parents and healthcare providers, and improve follow-up care for infants with a detected condition. The Reauthorization Act also seeks to reauthorize the Advisory Committee on Heritable Disorders in Newborns and Children, or the ACHDNC, which is the committee that's responsible for making recommendations to the Recommended Uniform Screening Panel, or the RUSP. So they're obviously a very important organization, or very important committee that makes recommendations to the Secretary. They recently recommended that both GAMP deficiency and MPS 2 be added to the RUSP. And so this bill would reauthorize them to ensure that they can continue to review and recommend new conditions moving on in the future. And so the ask would be to ask your member of Congress to co-sponsor the Newborn Screening Saves Lives Reauthorization Act. Like Caroline said, this bill has actually already passed the House. So you can ask, or you can thank your member of Congress on the House side if they supported the legislation, thank them for their support, and encourage them to ask their Senate counterparts to co-sponsor and pass the bill, and then obviously ask your senators to please co-sponsor and support the legislation moving forward. You can go to the next slide, Caitlin. And so the third legislative ask is asking your member of Congress to support the Help Insure Lower Patient, or the Help Copays Act. And the problem this bill seeks to address is that people living with serious chronic health conditions often face multiple barriers to therapies they need to treat their conditions, like administrative hurdles to prior authorization and step therapy that limit access to specialty medications. This means patients face skyrocketing deductibles and steep cost sharing with no other options to afford the medicine they need. Many patients are forced to turn to charitable or manufacturer copay assistance to afford their drugs. And so the solution would be to pass the Help Copays Act, which would seek to eliminate barriers to treatments for patients, ensuring that they can afford the necessary and life-saving medications prescribed by their doctors. The legislation requires health plans to count the value of copay assistance towards patient cost-sharing requirements. This would bring much needed relief to vulnerable patients by ensuring that all payments, whether they come directly out of a patient's pocket or with the help of copay assistant, counts toward their out-of-pocket costs. And so the ask when meeting with your member of Congress would be to ask them to support the Help Copays Act. You can go to the next slide, Caitlin. And finally, the last legislative ask is to ask for their support of the Access to Genetic Counselor Services Act. And the problem this bill seeks to address is that current Medicare policy denies direct access to highly trained board-certified genetic counselors to navigate complex factors affecting their health, which results in limited access to genetic counseling services, which results in increased wait times for genetic testing and subsequent delays in diagnosis. So the solution would be to pass the Genetic Counselor Services Act, which would provide Medicare beneficiaries with direct access to genetic counselors, enable genetic counselors to bill Medicare directly, enhance team-based care for patients, and address health disparities for those with lower outcomes. And so your ask for this one would obviously be to ask your member of Congress to co-sponsor the Genetic Counselor Services Act. Next slide.
Perfect. Thank you, Claire, for covering those. I had someone ask this question in the chat, so I just wanted to quickly throw this in there. These are our recommended ask, but if you want to make a different ask, that's okay. You are welcome to make any ask you like. We just ask that you do create a one-pager for that ask, and you can find information on how to do that on the Rare Cross America website. There are also a lot of like general Rare Cross America questions in the chat. So I just wanted to remind everybody that we are doing another training webinar on the 19th, where we will cover all of the Rare Cross America information and answer any general questions that you have. So I encourage everyone to also attend that training webinar on the 19th. And if you haven't already registered for that, you can do so on the Rare Cross America website. If you didn't get time to tell your story and you want to, I'm going to put my email in the chat. I'll hop on a call with you. We can hop on a Zoom together and go over it. So if you didn't have time to share today and you are interested in sharing, please send me an email. My email is in the chat. Awesome. So I am going to ask some of our coaches to unmute and give some key takeaways from your breakout rooms. I'll say that my room was fantastic. It was full of mothers of rare disease patients, women who have rare diseases themselves, and everyone that shared their story shared a very powerful, relatable, and emotional story. And that is exactly what you need to do when you go into your meetings. So coaches, if anybody else wants to share some takeaways or from highlights from their room, you can go ahead and unmute yourself and go ahead.
It's Rachel here, one of the coaches. I just would like to mention a huge takeaway from our group was the importance of the legislative scorecard. I think that it's a very great resource, especially coming into your meetings, getting to know who you're talking to. Because you might come into a meeting not knowing exactly what your legislator is about, and then you ask them to join the Rare Disease Caucus, but turns out they're already part of it, which is great, and you can thank them for it. But it's even better if you can come into the meeting and thank them right away, and not just finding out this information as you're in the meeting. Be like, hi, Senator so-and-so, I noticed that you're part of the Rare Disease Caucus. Thank you so much for your support in that. And that just starts off your rapport with them. Like, oh, this person already knows so much about me. Let's continue this conversation and see what else we have in common. So that's always a great jumping off point, or it doesn't have to be the Rare Disease Caucus. It can be, thank you for supporting this bill. I see that you're already part of it. Or it could be, I noticed that you're not part of this bill, you're not supporting this bill. Let me tell you more about it. So it's always a great conversation starter, especially getting the interest of these legislators. I know that personally, I like to talk about myself, and I'm sure legislators like to talk about themselves as well. So bringing up things that they're already interested in is a huge takeaway, a huge thing to bring into the meetings.
I'll piggyback on that. I'm Britta, everybody. And we had a wonderful group of some brave souls who gave it a go. And a recurring theme for us was how to be memorable in your meetings, right? These senators are representing people from all around the state, and members of Congress have at least 600,000 constituents. So how do you stand out? And I'll give you two examples that came up in our group. And one was that Linda, one of our advocates, has 5 family members who have passed away from this particular rare disease. So we talked about her putting faces to these 5 people and literally coming up with a show and tell, folks. She was going to do pictures of these 5 individuals with the year they were born and the year that they died, and to be able to really, that would stick with me if I were that senator or staffer saying, wow, and seeing their ages and seeing, wow, really that picture is worth 1,000 words. And another example is, that was show and tell. Another example is think of it, a turn of a phrase that you can, help to be memorable. Darla, one of our advocates, was recently on The Price is Right, and the senator's aware of that. It's a point that they've talked about and something that they share. So bringing that up, I'm Darla. I remember, the Arkansas's Price is Right, winner, and make that connection. But Senator Bozeman, what you can give me that Drew Carey can't, those 4 watches and set of luggage that I won was great. but what you can give me that you carry can't is a cure for my disease, is research for a cure for my disease. And this is how you can do it, by supporting, you know, X research. So that gives me tingles, you know, that really makes me kind of well up when I hear that turn of a phrase. So that, how to be memorable in your meetings.
I love the process, right, Ty? That's amazing.
Right? I know.
That's great.
Amazing.
Awesome. Well, thank you, Rachel and Britta, for sharing a bit more about your breakout rooms. I know that all of you have very powerful stories to share. So I really appreciate you joining us, you know, just to learn more about how to tell that story. And you can continue to practice with the sheets that we sent you. I'm going to send those again just to make sure that everybody has a copy. Continue to fill those out. You can practice with those. One thing that I also think is really helpful is practicing with yourself, practicing in a mirror, using your phone to record yourself and listen back, even though most of us don't like to listen to their voice on a recording. It's so helpful practicing, you know, thinking, you know, how does this feel? How does it sound? Is it brief? Can they hear me? Can they understand what I'm saying? Figuring out if you say terms that I say, like and like all the time, and making sure that you're including a call to action, what it is that you want them to do. And then give yourself some notes. What can you change? What could you do better? So this practice is very important and can really help you refine your story. And there's so many ways that you can share your story too, even beyond the meetings with your members of Congress. So we have two really great opportunities here. If you are an artist, we have our rare artist contest. We did just extend the deadline to July 15th. So you have one more day to get in your art if you're interested. This is a really great way to tell your story. So, and you can check out all of the past submissions on our website. We have a gallery on there. It is very cool. So I definitely recommend checking that out. And then we also have our story bank. You can find it on our website at everylifefoundation.org/story. We're always looking for people to tell their stories. You know, this is just a very, very important tool in advocacy. So if you are interested in sharing your story further, you can go check that out and submit your story on our website. But thank you guys all so much for being here today. Thank you to our coaches for taking the time to come and give everybody feedback. I appreciate you guys all sharing your expertise, and I really appreciate everyone coming to share their story. I know that it's very personal, the information that you're sharing, it's very emotional, and it's not easy to sit in a Zoom breakout room full of people that may be strangers to you and tell this story. But all of your stories are incredibly powerful, and all of your stories can really impact and affect change. And so I really appreciate you coming and joining us and learning more about how to tell your story. And I mostly appreciate you signing up for Rare Across America to meet with your members of Congress. I mean, this is going to be a really great Rare Across America. So I appreciate all of you guys so much. And if anybody has any questions or didn't get an opportunity to share, if there's anything you need, period, Rare Across America related or RDLA related, please feel free to send me an email. I'm going to put my email in the chat one more time, just in case you don't have it. And I will also really quickly plug the Rare Across America website. We are updating it. It's going to have a ton of resources for you to prepare for your meetings. So please check out the Rare Across America website. If you're feeling unprepared or you're not sure where to get started, the website's going to be great for you. It's broken down into 2 sections. So how to prepare and execute your meetings, and then what to do afterwards. So you can go and click on prepare and execute, and there's going to be a whole page full of resources there for you. We also have the additional training webinar on the 19th. And that's really going to break down Rare Across America. So what your meetings are going to look like when you get in, what the breakdown of the meeting even is, So we're going to get into a lot of tips and tricks there. And if you're not able to attend that, that is okay. We're going to record it and it'll be on the website for you there. So if you're feeling unprepared, if you're feeling confused, that's okay. This can definitely be overwhelming, but we're here to help you guys sort it all out. So if you need anything, please feel free to email me and we will get you prepared, I promise. So thank you guys again for being here today, and I'll see you on the webinar on the 19th. Bye, everybody.